Ambulance emergency. Tell me exactly what happened. Okay, so my brother is epileptic. We think he's had a seizure, but he's in the bathroom and the bathroom door's locked. But you can't get to him. We can't get to him, no. Okay. And how old is he? 21. 21, okay.
So I'm going to stay with you, okay? Okay, so just let me know if he talks to you at all. If you hear anything from him, let me know.
Sydney to car 640.
640.
Take 640, I can get you to back up ECP on the way to 1C, epileptic, copy.
Yeah, 640, copy that.
Due to the urgency of the case, 2 ambulances are dispatched immediately. An extended care paramedic is en route, and in car 640, Marco and Shanae are still 10 minutes away.
Should we start rescue? Thank you. And Sydney to 640.
640, copy that.
Are you in? Okay, the door's open.
Oh, they've got access?
Yeah. Oh my god, getting everyone here. There's a lot of blood. Shit.
Patient is covered in blood, so there must be something more to this.
Okay, so listen to me. Is he breathing? Is he breathing? Yeah, is he awake? Yeah, he is awake?
Yeah. Okay.
A 21-year-old epileptic patient has been found passed out on his bathroom floor, covered in blood.
Has this got anything that is a known epileptic or?
No.
2 ambulances are coming, lights and sirens. An extended care paramedic has been deployed, along with units 640, Marco and Shanae, who are still 6 minutes away.
I think being a dad, in regards to dealing with young people, it's the hardest part of our job, just because of the vulnerability of it.
How old is he? 20?
21. There's always an aspect of anxiety around that for me. I always think of my kids when that happens. What's your name?
Lisa.
Lisa. My name's Marco. I couldn't think of anything worse in the world than anything happening to my kids or to someone else's. Lee. Just relax, mate. So, Lee, my name's Marco. I'm from the ambulance.
Yes.
Mate, you look like you've hurt yourself pretty badly. So what's happened?
He's come to the toilet, and next minute we heard thump. And then Liz came to the door and Lee, nothing, and she thump, so he's having a seizure. He's
a known epileptic?
Yeah.
So mate, do you know what day it is today?
Yeah.
What's today?
Today is...
Just take your time. It's okay, all right? All right? It appears you've had a seizure, okay? So you're probably in the bathroom and you just hit the ground, okay? That's why you got a bit of blood on yourself. You got a decent bump to the head, okay? Does he usually have multiple seizures when he has seizures, or is it usually just the one and then he's...
It's usually just the one.
Yep.
He hadn't had it for like 6 years. He had a brain tumour, which got taken out about 4 years ago.
I think it's probably a good idea that we go up to hospital. So you're right to hop up for me? Yep. Okay, mate. Good boy.
Watch your shin on that first step, and then you can come and have a seat on the bed there.
Lee is one of 250,000 Australians living with epilepsy. During a seizure, the brain becomes starved of oxygen, and due to the patient's recent brain surgery, he'll need to undergo a full hospital assessment.
Remember what day it is yet?
Not really.
Not yet?
No.
Okay, so I want you to remember a couple of things for me. I remember that it's Sunday. Okay, so today's Sunday.
Okay.
The month's July.
Yep.
And the year's 2018. Okay, and I'll ask you that in another 5 minutes.
Yep.
See if you can retain that information for me.
Whether or not Lee can pass the cognitive test will provide Marco with a better understanding of just how seriously the seizure has affected his brain.
All right, so Lee, I asked you to remember a couple of things for me. The day, the month, the year.
So I went to the day. 2 months.
That's all right. I'm going to ask you again in about, just before we get to hospital, okay? So I just need your memory to get a little bit better for me. If he doesn't pass that simple question, which he'd normally know, at the moment, my assessment, his GCS, which is his level of consciousness, is confusion. So he's still confused. If he doesn't know that question, which is quite simple, he's failed that test.
You don't really want to be going to hospital. No, you don't. It's a bit similar because you've had it happening in your eyes and you can
It is distressing to see a panicked parent. A lot of time when you calm down mum or dad and try and reassure them, it never usually works because they're always going to be worried because it's their baby, you know, it's their life. It's a big part of the job. You've got the patient, but you're also, in a way, treating that relative as well.
You know what? If I didn't feel you had to go, I wouldn't take you. But because you've had the knock to the head, you've had a seizure, and this is not hugely normal for you, we need to find out why. And we need to just make sure that you're okay.
I've always been a person that's wanted to care for people.
How are you going now?
It's a job where you come across people at their most vulnerable.
Clear in the head?
You have the power to do something to help that person through what they're going through. And I love that.
Okay, so do you remember what day it is?
Today is Sunday.
What month is it?
God. Month. I couldn't tell you.
What year is it?
2018.
All right, we're getting there. We're getting better, Lee.
Slowly.
Slowly.
That's my favourite part of the job, changing a negative situation into a positive.
How you going?
Good, thank you.
Feeling better?
I am, yes.
A couple of bumps as we go out.
You can see it throughout the job. When we first initially arrive, you see that person, they're completely distressed, whether the patient or the bystander. And then you do what you do, and then by the end of the job, they're smiling, laughing, having a joke with you. And that's what makes me tick. It's working for the smiles.
He hadn't had a seizure in like months, and before that years. It could have been a lot worse. He could have had an occluded airway, and it could have been fatal. So, yeah. What do you
He's
think?
got a hot date tonight too.
Does he?
I told him he had to wear a hat to cover up these eyes.
No,
But you might
chicks dig scars. Just say he was in a fight.